In this video, we are going to cover some basic exercises for the lumbar spine. The techniques covered in this video include a hip flexor stretch and pelvic centering. First up, we have our hip flexor stretch, which can be used to stretch and lengthen the hip flexor muscles, such as the rectus femoris or the iliopsoas. The patient will be standing next to a step or stairs, and the patient will first place the foot on the opposite side of the hip that needs to be stretched on the step, and then bend the knee and lean into a lunge while making sure that their hips are kept straight and do not lean forward. So as we can see, the patient is standing and they can use a countertop or railing for balance, placing the foot from the side that does not need to be currently stretched on the step, leaning forward while keeping their hips nice and straight. And from the side, so as you can see, the patient is stretching their right hip flexors, so their left foot is on the step. Next, we have pelvis centering, which can be used as a neuromuscular re-education for improved posture. The patient can either be seated or standing. We're going to ask them to arch their lower back maximally and then flatten as much as possible, so move into as much of an anterior and then posterior pelvic tilt as they can. Then find the midpoint between those two extremes and to try and keep their pelvis there. Then they will shift all the weight over to one hip and then the opposite hip before finding the middle and distributing weight equally over both legs or hips. So as we can see, the patient is going to go into an anterior pelvis tilt and then a posterior pelvis tilt, finding neutral before then doing weight shifts over one leg and then the other leg. And then we can see her in sitting doing the same thing, just from a slightly different viewpoint. Again, we want to keep the hips in neutral between both front to back and side to side, and have the patient try and keep their hips there as they go about their daily activities.